In this video, we will look at 12 unusual signs that may indicate liver damage. It's important to know these signs because you can take action to prevent the condition from getting worse. Your liver has an amazing ability to heal itself with some help. The common belief that liver damage is primarily caused by excessive alcohol consumption is somewhat misguided. In fact, excess sweetened and processed foods and beverages, excessive consumption of vegetable oils and fast foods, frequent use of painkillers such as acetaminophen or ibuprofen, viruses that lead to liver damage and hepatitis, and other factors, and the list goes on ad infinitum. If you want to check if you have liver problems, stay tuned and watch this video to the end. We will also discuss some simple home remedies to detoxify the liver and prevent further damage. This video will be extremely informative and helpful. So, if you want to become a master of your health, click like and let's get started. The first sign of liver problems is a light-colored stool. When you go to the bathroom, your liver secretes bile acids to help digest fats from food, which gives your stool its typical brown color. But if you have fatty liver disease or liver damage, the outflow of bile can be impaired, resulting in light or clay-colored stools. In some cases, due to undigested fat, the stool may even float in the toilet water, giving it buoyancy. The second condition is associated with difficulty seeing at night. If you can't see well in low light, especially at night, it could be a sign of retinol or vitamin A deficiency. Bile production by the liver plays an important role in the absorption of vitamin A, which is needed by the eye's rod cells to adapt to different light levels. Liver disease can disrupt this process, leading to insufficient absorption of the vitamin and so-called night blindness. This symptom can also indicate an overcrowded gallbladder, especially if you also experience dryness, soreness, irritation, and rubbery eyes. The third symptom is a swollen right leg. When blood flow to the liver is compromised, it can cause it to swell and enlarge, which in turn puts pressure on the portal vein. This can lead to fluid or water buildup in the legs or feet. Pressing your finger on the swollen area may leave an indentation. If you notice that the right foot or ankle is more swollen than the left, this is a common sign of possible liver damage. We'll talk more about natural remedies to improve liver function later in the video. Sign number 4. White growths on the eyelids. Another unusual sign of liver damage is the appearance of small white or yellowish growths on the eyelids. These are tiny clusters of cholesterol deposits that accumulate under the skin due to the inability of the liver to break down cholesterol effectively, causing it to accumulate in various parts of the body. Number 5. Feeling of pressure in the right side. Another potential sign of liver disease is a feeling of pressure or discomfort in the right side of the chest, especially after eating. Due to liver damage, bile can become thick and cloudy, which can clog the small tubes that connect the gallbladder, leading to a feeling of pressure and discomfort around the ribs. This pressure can also affect the phrenic nerve, causing muscle tension and pain in the right shoulder area. Number 6. The presence of purple and red spots. When your liver is congested, inflamed, or impaired, it produces fewer proteins needed for normal blood clotting. As a result, you may be more prone to bruising and sometimes unusual purple or red bumps that resemble a rash, as well as small red spots on your skin. This often occurs in areas such as the shins or arms and is due to decreased blood circulation associated with liver disease or perhaps diabetes. Number 7. Cracked heels. Your body relies on vitamin B3, also known as niacin, to keep your skin strong, smooth, and moist, preventing it from getting damaged. But if you suffer from liver disease, your body diverts niacin stores to repair liver damage, leaving less of this important nutrient for other functions. This can cause the skin on your feet and heels to become dry and cracked. You can address this problem by increasing your vitamin B3 intake and addressing the underlying problem, which is often fatty liver disease. Number 8. A constant urge to scratch the palms of your hands or the soles of your feet. This condition is caused by the accumulation of bile acids under the skin as a result of insufficient filtration of these acids by the liver. This accumulation leads to a buildup of histamines in the blood, which provokes itching. Number 9. Completely white or delaminating nails. If your nails are completely white, have lost their natural pink color, or have become rounded, beveled, or bulbous in shape, it could be a sign of significant liver damage or another underlying health problem. Such a condition can impair oxygen delivery to the nail matrix. Interestingly, in the 1950s, researchers found that 8 out of 10 people with severe scarring of the liver had nails that were completely white. Number 10. Dark urine. Your liver plays an important role in breaking down old red blood cells, which contain the yellowish pigment bilirubin. If your liver or gallbladder is damaged, this pigment can build up in your body and eventually be excreted with urine. As a result, urine can become a very rich dark orange, amber, brown, or cola-like color because the liver is not processing the pigment properly. In addition, certain medications such as antibiotics, sleeping pills, or birth control pills can also contribute to urine discoloration by putting a strain on the liver. Number 11. Yellowing of the skin. When the liver does not work properly and cannot effectively filter bilirubin from the blood, it can lead to skin discoloration. This can lead to a yellowish tint on the skin, which is called jaundice. Jaundice is a clear sign of significant liver damage, which can be caused by conditions such as hepatitis, cirrhosis, drug, or medication poisoning. If you notice yellowing of the skin, you should seek medical attention and consult your doctor. Number 12. Presence of vascular asterisks. Spider veins resemble tiny red dots with spider-like dilations of blood vessels that become visible on the skin. These are blood vessels that have been affected because your liver is inefficiently filtering out excess estrogen. Elevated estrogen levels can weaken the blood vessels in your veins, causing them to dilate and spider veins to appear on your skin. If you are experiencing any of the symptoms described here, we highly recommend that you visit your doctor and have an ultrasound. How do I reverse liver disease? As mentioned above, the liver goes through 4 stages of destruction. First, it accumulates fat. Then, inflammation develops and scar tissue known as fibrosis forms. In the most advanced and potentially life-threatening stage, the disease progresses to cirrhosis. Fortunately, there is hope because the liver has an amazing ability to fully recover and regenerate if you improve your diet and use appropriate remedies. So, let's take a look at the most important steps to help reverse liver damage. Number 1. Improve your diet by reducing your intake of sugary, starchy, and flour-containing foods such as bread, cookies, candy, ketchup, pancakes, pasta, and sodas. A fatty or weakened liver reacts to fructose, a sugar found in fruit, the same way it does to alcohol. Number 2. Include lots of bitter and sulfur-rich foods in your diet. These include leafy greens, artichokes, radishes, garlic, broccoli, Brussels sprouts, kale, cabbage, mushrooms, pasture-raised eggs, wild salmon, fatty fish, walnuts, onions, shallots, and broccoli sprouts. Foods rich in sulfur help reduce fat accumulation in the liver by increasing glutathione levels and helping to detoxify harmful substances. Number 3. Start your day with a cup of homemade organic coffee. Add a teaspoon of turmeric. The polyphenols in coffee and the phytonutrients in turmeric are effective in reducing the formation of scar tissue in the liver and aiding in its repair from damage caused by alcohol, drugs, or fructose. Also, try to drink at least a liter of high-quality mineral water throughout the day to thin the blood and support the liver in producing bile to break down fat deposits. Add freshly squeezed lemon or lime juice to your water to increase filtration of toxins in the liver. More information on this topic can be found at the links in the description below this video and on our channel. Subscribe and hit the bell for all notifications. Please like and share this video with your friends. Thanks to our sponsors for their support. I eagerly await your comments and encourage you to watch these useful videos.